Thanks for that introduction, Monica. And I guess we will be speed dating for about 15 minutes each. So I hope we both can engage in a nice conversation during that period. And so I want to take us on a trip a little further upstream with my remarks and really kind of take a look at some of the social determinants that Nico talked about in his opening remarks earlier today. And so where I want to begin is where the Democracy Collaborative really gains its focus and what we're trying to help tackle, the increasing problem of inequality in the United States. And this is a driving force for our lens, but I think it's also one that many different sectors, including business, are beginning to recognize the important need to focus on this topic. And the S&P Standard & Poor's in 2014 released a report basically talking about how inequality is dampening U.S. growth, and looked at a number of factors of why this is actually a need that we need to think very constructively about. How do we address this increasing tide? And I think another area that we need to focus our attention on, and something that often gets overlooked in this context, is the incredible disparities by race around wealth in our country. And especially as demographics continue to change over the next 30 years, these discrepancies will only exacerbate the inequality issues that we currently face. And I think it's notable to recognize that these gaps were significant before the Great Recession, but they actually increased after the Great Recession. So the gaps between whites and minorities in terms of net household worth, so not even talking about income, but talking about wealth, is greater now today, and we're seeing this play out in cities across the country. And so what happens as a byproduct of these disparities? What you're looking at in front of you is a map of Cleveland. On the left is the urban core of Cleveland. You can see the university hospitals and Cleveland Clinic clearly marked. These are premier world-class health institutions. But you can also notice very quickly that the neighborhood directly proximate to those institutions has the lowest life expectancy of any neighborhood in that entire metropolitan area. 64 years life expectancy for the average male, and just 8 miles down the road, Lyndhurst has a life expectancy of 88. And the differences between those communities is dramatic in terms of investment, but I think it's also important to look at demographics and wealth to take us back to the previous two slides. Huff is a neighborhood that has suffered tremendous disinvestment since the '68 riots, race riots that devastated it. It's predominantly African American. It is a median income of under $20,000. And then down the road, you have a predominantly white suburb, upper middle class. And so what has happened is that the factors, the social and economic factors that are so critical to health, become concentrated in place. And so our perspective at the Democracy Collaborative is that place really matters, and we have to think about how do we drive investment back into place to tackle some of those upstream determinants that are really so critical to address before we can really do the hard work of changing behavior. I think it's difficult to ask people to think about always changing their behaviors when they're facing a set of challenges that are much more significant in their daily lives, figuring out how to navigate 3 bus systems to get to a job on time, figuring out what to do with their children when childcare is extremely expensive, figuring out where to even buy affordable fresh food and vegetables in their community. And our approach at the Democracy Collaborative is one that we call community wealth building. And I think it's a recognition that an approach towards equity and inclusion is a strategy that benefits all of us. It benefits our communities, and it benefits business as well. And I think we heard these remarks earlier, especially as we think about a workforce that is not growing in the same way that, there's increasing demand for the same workforce. We do have the people in this country to do the work. There's just a greater gap and divide between some of our communities in terms of access to good paying jobs. And what are the steps that as businesses can begin to do to think about creating those connections in a more thoughtful and direct way. And so as you can see, one of our drivers is, instead of the common strategy, which is to have workforce intermediaries that give people skills but don't connect them to jobs, how do we kind of flip that model on its head and think about direct local hire pipelines? And I'll talk about an example of that in a little bit. And so at the collaborative, we focus on the role primarily of not-for-profit and public institutions as large employers and economic engines in their community. They're businesses that are often overlooked. And what are these anchor institutions, as we refer to them? Hospitals, universities, local governments, they could be utilities, other institutions as well, that are really bounded by their mission. They're bounded by who their customer base is and their fixed investments. And they represent a form of sticky capital that we think is an important asset to be leveraged. And I think something that's often overlooked is that, we were talking yesterday about how in one particular community, these are sometimes the only assets that are engaged. I think in most communities they're overlooked. And hospitals, universities, public school systems, local governments are actually the largest employers in many of our communities. They actually represent the economic base. And how we begin to think about leveraging those assets in an inclusive way to grow our communities and revitalize some of our cities, I think is an important question that we can be asking. So I'm going to focus specifically on health systems and what some of these organizations are doing in terms of going upstream to think not only about their role in providing health care and not even only their role in providing opportunities for changing behaviors or addressing issues such as obesity and smoking and other things that are critically important to address in the community, but also what is their role in beginning to tackle the social, economic, environmental factors that really lay the foundation for health outcomes in many of our neighborhoods. So I'm going to run through these quickly. I just wanted to show quickly the economic impact of health systems in the U.S., and this is something that I think is often overlooked. And what we think about at the collaborative is not necessarily what is the check they can write for this work, but how can they change their business practices to align in a way that is a win-win for everyone. And so thinking about the large amount of employment, the large amount of procurement of goods and services, and the massive investment portfolio, in essence the savings that are invested in traditional stocks and bonds, and how this can begin to be leveraged within a specific geography. And so these are just some of the examples of those strategies and what can begin to be deployed in a more thoughtful way to have an impact on the local community that these institutions serve and hopefully create a more healthy region over the long term. So this was a quote from the CEO of University Hospitals, which is the second largest employer in Northeast Ohio, employs more than 20,000 people. And they had the opportunity to build out their plant, their health system, an investment of $1.2 billion. Well, I'll get back to that example, but I think it's going to take shape in many different communities in many different ways. And so I'll start with Hopkins. For those of you who know the history of many of these health systems and universities and their communities, it's not often a positive one. There's tremendous tension, especially when we talk about the existence of these institutions in urban cores. Usually they're islands of wealth surrounded by seas of poverty. And that's been the status quo for the last 40 years in many of these areas. And Hopkins has, over the years, taken a lot of flack for its treatment of the local community. The local community is often said, the Hopkins only thinks of us as a parking lot. I think they're finally making a shift. And now, in this process of making the shift, they're bringing the entire business community along with them. They're saying, we're not going alone. We're going to ask other for-profit and other large businesses within this community to come along in committing to build, hire, and buy from Baltimore, from the neighborhoods that have been disinvested for the last 40 years. I'm going to run through these examples quickly, and I'm happy to go into depth on any of them during the Q&A period. University hospitals, they had the opportunity to spend $1.2 billion. They said we could do this the way we've always done it, take the largest contractor, or we can think intentionally about creating opportunities for minority and women-owned businesses. We won't increase our costs. We're actually going to create a more dedicated supplier base that really wants to do business with us. It's going to be smart business, and we're going to drive 92% of this $1.2 billion into the local economy during the height of the Great Recession. And that's led to a citywide voluntary CBA that 9 other large businesses have signed on to about how we're going to change in the culture of how to do business within this city going forward. Dignity Health, they have a savings portfolio of about $5 billion. What happens if we take perhaps 1% of that might have been in T-bills, treasuries, safe, really low return investments, and think about how we can leverage that within community development financial institutions, organizations that are committed to making investments in low-income neighborhoods, or help address the affordable housing crisis in some of the geographies that they sit. This is an example of how they provided patient capital for a children's museum that was wandering, and that became a catalyst for revitalization in this specific low-income part of Phoenix, and provided a safe place for the children of that community to play. I think that's how some of these upstream investments really get to or kind of create the foundation for healthier environments that people can thrive in. Bon Secours Health System has done tremendous work in the west side of Baltimore, in the area where The Wire, the HBO documentary, is famously filmed or based on. They've, as a health system, they've built affordable housing. They've invested in workforce development. In Richmond, they've been a key partner in using a part of their savings in a CDFI and bringing a grocery store to a food desert. This was a commitment they made to the community 5 years ago, and they're working on it. It's hard work. It's there's obviously significant systemic challenges in many of these communities. But it's a commitment that they've made, and they've really said, how can we be a partner for not only well-being and health, but also justice within this community, the east side of Richmond, Virginia. ProMedica is a suburban-based health system, but they recognize that they need to see Toledo begin to thrive, which is the urban core that they have more prosperous health systems around it. And I think what was interesting about this one is that they started off with a community health needs assessment that first uncovered obesity as an important thing that they needed to address. As they began to dig a little deeper, they actually discovered hunger was a significant problem in their community, and they took a couple of baby steps, intermediate steps, about how to begin to reclaim food that was being wasted, but they've also made a significant investment in building a grocery store that actually is a subsidiary of the health system, because they couldn't find a private grocery store to come into this market, and that could be debated on whether there isn't a market, or whether the traditional process for deciding whether there is sufficient demand might not be the best for this specific community. And they're layering onto it dental services, so they're commingling different services, financial literacy programs, job training. Think about how the grocery store can begin to be a pipeline for people who work there. Maybe then they can move over to the health system and begin a job there. How they can use this grocery store to now support local businesses and create opportunities. They're thinking about how they can build the supplier capacity of minority and women-owned businesses in Toledo, and saw this as a lower risk opportunity for them to kind of get that experience. And again, this is not charity. It's about a long-term approach to reinvesting back into the community. Lastly, I'll just talk about a project that we've been involved in Cleveland, Ohio, that was an economic inclusion, a piece of a broader revitalization effort led by the anchor institutions in the greater university circle. So the hospitals and universities, which represent the largest employers in that city, in partnership with philanthropy and the city. And one piece of this was, and it should be noted that this was the first time those institutions had ever collaborated, even though they sit within a 1 square mile radius. So there's a lot of trust that needs to be built, and I think at the core of this work is simply the relationships that need to be formed and nurtured, and who are the neutral conveners that can kind of have people set aside their egos and come to the table and think about, the woman I was talking to from ProMedica was saying that in the healthcare world, we agree to set aside business interests for safety. We should set them aside for community as well. And I think that principle is something that we can take to other areas of this work as we do it. Very lastly, part of this is moving from doing good things, indiscriminate kind of charity and grants, to thinking about how we can be accountable for all of our impacts. This is a slide we did in participation, in partnership with Kaiser Permanente. And this is how Kaiser is beginning to think about how we can leverage really all of our assets to have the greatest impact within the geography that we sit. And I think that's where you get that shared value, that this is going to have a long-term ROI for that institution as they make a commitment, as they know that they're going to be in that place for a long time to come. So thank you. I appreciate you inviting the Democracy Collaborative to come here and share our perspective, and I look forward to the conversation.